So Steve, why is the pancreas involved in this condition, familial chylomicronemia syndrome?
So we know that the driving factors when your triglycerides are over 1,000 and the higher they go, the more likely it is you get pancreatitis. So it's the very high triglycerides. And the mechanism, the cause of these high triglycerides triggering pancreatitis is twofold. One is it causes all the red blood cells in your smaller blood vessels of your pancreas to begin to sludge. So things are backing up. You don't get enough blood supply to the pancreas, enough oxygen and nutrients. So that's one factor that tips over the pancreas from getting inflamed. The other factor is that these very high triglycerides with the lipase from your pancreas, the lipase breaks down these chylomicrons and triglyceride particles into these very toxic particles called free fatty acids. These free fatty acids, basically, they injure the pancreas as well. These two factors together trigger an episode of pancreatitis. Clearly not the only factor, because otherwise patients with FCS or patients who have other causes of very high triglycerides would have pancreatitis around the clock. So there must be other factors that also play a role.
And why is so important to keep an eye on the lipid profile of these patients? And what are you aiming when you have a patient with high triacylglycerides?
Since the studies have shown that 1,000 milligrams per deciliter, that blood test for your triglycerides, when it's above 1,000, the value, that's when your risk of pancreatitis goes up significantly. As long as you're below 1,000 and ideally below 500, then your risk of pancreatitis comes down. The lower you can get that triglyceride value, though, the lower your risk of pancreatitis will be. So we try to aim for a value that's as normal as possible and at least below 500 if we can achieve that. Even though we're looking at these triglyceride levels, we're looking at them at fasting. So when you come in the morning, we draw your blood. The problem is your triglycerides in response to a meal go way up. And that's one more reason we're trying to get these triglyceride values to as low a value as possible towards normal.